question around 10 or so on our social media platforms.
Yes.
Thank you. All right, let's go into the KUAV News Zoom room where we have Education Superintendent John Fernandez. Do we got him? I could go to break. Okay, he's here. Superintendent John Fernandez joins us. Good morning, John.
Half a day, Chris. Half a day, team.
I just got to ask right off the bat because we had a couple bus drivers on yesterday, and they were talking about preparing for a return to face on Monday, September 20th. And so I asked, well, where are you getting that information? And they said, oh, it's a rumor. So, I mean, I don't know. Let's just start there. Are we returning to face on Monday?
So my understanding is that the governor would like to review just the latest, the latest statistics coming in these next few days regarding the cases, and then we'll make a determination before she issues an executive order. She is interested, and this is just from my direct conversation with her, and I think she is interested in reauthorizing the opening of schools. But again, she's kind of weighing that against where we are with the new cases and what the public health is seeing. So again, that's I guess the first thing we have to wait for, and I would advise all of our stakeholders to wait for is, first of all, the governor has to take action to authorize it. That'll likely come out in an executive order. The Joint Information Center will put that out, and then from there, based on what the executive order says, that'll determine when and how we open. My understanding is that, I guess at the very latest, is that when she does reauthorize, she will pick a date that will be at least the earliest that schools can open, but she's going to leave it to the individual schools or school districts like GDOE or the Catholic schools to determine how they want to open and when they want to open after that initial date. So I don't know what to expect. That we're here in midweek. I did ask, of course, for as much notice as possible for GDOE once that decision is made, and then we'll definitely go from there to inform our community as to what's next. We have a work session tomorrow with our board to kind of go through our plans for the school reopening and kind of let them know what we're thinking through and what our options and recommendations are, and not just for what we want to do in the first week that schools open, but taking a look ahead as to what the medium term and long term expectations are. What we want to do is we want to avoid another full shutdown if possible. And I mean, it's so disruptive to shut the entire school system down that we've been looking at, what are these other options that will allow us to create a safer campus, help our stakeholders feel more comfortable, but at the same time, avoid having to close down the entire school. So, entire school district. So that's something we'll be working with and discussing with our board, and we've had a lot of discussions about how to approach that already. I think we did a lot of planning to reopen schools, but this planning, the planning right now is what to do in a situation where you might see continued fluctuations in the community health environment. It's easy to open schools, it's easy to close schools, but when you think about how to sustain education over the year, what are the various approaches that we can take to try to sustain in-person learning for as long as possible? And so that's a little bit different from where we were over the summer, but definitely something that I think we're prepared for, and something that we just need to work with our stakeholders to communicate and help them understand and try to address their concerns and anxieties about where we are. And then there's also a lot of moving parts. So even as we plan, people are asking about the boosters. People are talking about when we find out about the employee vaccination mandate and how many employees are fully vaccinated. People want to know when a vaccine might be available for 12 and for under 12, the under 12 age group, and so forth. So as we get any further information, that those could continue to, shape and impact our strategy. And again, some of those questions we still are waiting for. We don't know the answer to yet. So, I think we're prepared for her to issue her order. But again, when she issues that, whether it's tomorrow or next week, she is giving the schools the flexibility to make sure that we can return to school in an orderly fashion. In some ways, it does put the onus back on the school systems to determine, what safe campuses look like from the standpoint of meeting public health requirements, and also ensuring that our stakeholders are also comfortable and understand what's in place. But at the same time, if that's what it takes, we're prepared to have those discussions and really explain our approach to reopening schools.
What about discussions with the Department of Public Works? Because we did have a couple of bus drivers call in yesterday, and they were concerned about I guess there may be some new protocols for when students get on the bus.
So we do know, and I've communicated this to the governor and public health, that we've gone through our stakeholder meetings for a couple of weeks. In fact, I think just last week, as you know, we held one on Saturday and Friday as well, and the governor actually attended those. So definitely what happens is a lot of discussion about the community situation, a lot of discussion about what happens in school. But there's also, you always get the questions of, well, you guys say you're handling it in school, but what about the buses? They get on the buses, they're all together and so forth. And of course, we don't speak, we are not able to really speak in terms of what DPW is doing and thinking. I mean, we know what they're doing, but what they're thinking and whether they're going to change course, that's another discussion. So I did, communicate with the Public Works. I think it was actually yesterday, trying to get an update on their plans. And, I was informed, of course, that there are a lot of ideas floating around, but the public health guidance out there actually sets, actually the existing K-12 guidance for buses allows for full capacity, and of course, masking and so forth. Whether or not the DPW goes beyond that and is able to go beyond that to do hand sanitizers. I heard there was an idea of, air filtration, on the buses and so forth. That's something that DPW has to clarify and provide us that information as well. So I did actually reach out to Vince Ariola, Linda, Ibanez over at DPW, and Art San Augustine over at Public Health and his team, because as part of our school reopening plan, there is a lot of discussion about what the bus transportation mitigation plan is. And I think a lot of our, not just public, but private school and charter school, partners and their families are all asking the same questions. What is the plan? And is there anything that's going to change once we reopen? So we're waiting that information from Public Works. The only thing I think we were talking about is we get a lot of questions that coming from the outside, but I've encouraged people to talk directly to each other, because similar to me, I get a lot of questions, but they might not be coming from the right people that I need to meet with to make sure we're on the same page. Yeah. So I said, to the Public Health and Public Works, whoever's working to approve the plans needs to meet with us, needs to meet with the person working on the plan at Public Works, just so we can tighten up and make sure we answer the questions and don't get it second, third hand from things out in the media or social media about what's happening. Because, a lot of rumors out there, like you mentioned, Chris.
Yeah.
And even like you can say, even the employees are also, paying attention. So they get confused as well sometimes when they get a lot of unofficial. And the unofficial rumors are not coming from, some unknown sources. A lot of it's from credible sources,
of course,
who just may be aware of different, aspects of the conversation. Yeah. So I always say, wait till we get the official word, because they might be credible sources, but things change so rapidly in this environment. And I just hate for us to be out there with the wrong information and having to come back and walk it back, and then confuse everybody as part of, this, trying to relieve everybody's anxiety and stress. So,
I know. So that's why I kind of want to just go back, because, again, the return to face-to-face September 20th, just looking at what you said, it sounds like there's an EO pending, right?
Yeah, there would need to be an EO because we had this conversation on Saturday, and I know that when the governor said, look, when I authorize schools to open, I'm going to let the schools figure out, when and how they want to open. And one of our parents said, well, you heard it here. The governor said, superintendent, you have the authority to open. I said, well, no, technically we need an EO, that allows for the suspension on in-person learning to be lifted. And once that's issued, we're going to want to make sure we read the executive order to, make sure that we understand what those parameters are. But her intent seems to be that she's going to give a date, and anytime after that, she will allow, the schools will be allowed to figure out how they want to return in order for us to do it in an orderly manner. So we definitely don't want to hear that we're open on Friday evening and then on Monday morning expect people to be, in the classrooms and the buses on time and so forth. So we've told that we need at least 2 to 3 days to shift food service operations. So, that's why that whole notion of a week to transition is important, because there are some things that we need to shift back and make sure they're ready to go when students return to the schools.
John, when face-to-face return happens, just for clarity, will students who are currently on the online, because we moved everyone online, right? Will students who are currently online, who didn't sign up for online at the beginning of the school year, be given the opportunity to stay on online?
So the answer, just like last week, is no at this time. So, and part of that, again, is the fact that we have a lot of students who come to school face-to-face, and those teachers who are in those classrooms are the very same teachers we would have to pull to teach online if we had, online classes taking place. So the answer is right now, no. We do understand, of course, there is a concern that parents have going back to face-to-face. So that's why the return to face-to-face instruction is something we're looking at and looking at the options. And again, I think you might have heard us discuss this, that the possibility of reopening in cohorts is a very real possibility, depending on the risk, the community risk situation. So again, what I've been talking to our board about and our team about is that, if the governor reopens and we're still in the midst of some of these high numbers, to me, it looks like unless there is an absolute critical emergency that public health has to come in again and say, shut down, that she is actually willing to let the schools kind of operate and determine how to address the risk as long as possible before she does something, before she shuts down the school system again. So it looks like we're going to really have to be aware of and take a strong approach to how we want to operate, should those numbers go up and the governor, doesn't step in. So we've been looking at the CDC, guidance with regard to how to continue to track the community risk situation. And I think you've seen our dashboards before where we're back in the summer, we were at a low risk situation when it was time to open. And as you track the positive numbers and the new cases, we've moved from low risk to high risk, in a matter of 3 to 4 weeks. Under that high risk situation, what CDC recommends is not that you automatically close, but that you look at your safety measures and determine, what you need to strengthen or what you need to reinforce, given that the high risk in the community raises, school risk as well. So part of that, part of their recommendations have been, you might want to, again, they phrase it as, you might want to reinforce or expand physical distancing. To us, that is in line with our, this approach to cohort, to use cohorts when we're in a high risk situation. And then as the risk reduces, hopefully over time, you can determine when to resume, full 5 days of instruction. So it becomes a risk-based strategy that we can, operate with and use internally at GDOE. The other school systems, private schools might have to develop their own, but this is a way that we can work within GDOE to be proactive in taking those mitigating measures prior to the governor or public health needing to step in. So we're looking at that as the cohorting as a strategy, but only a short-term strategy to get us through this high-risk situation. And once the risk moves, reduces, then be able to expand, in-person learning to the full 5 days. The other things that are coming about, I mean, just based on the president's directive and the fact that when a lot of the guidance that CDC produced, a lot of that guidance still exists from when the vaccines were just early, in its early stages. So you've seen the president kind of pivot towards a more aggressive vaccination strategy. And so you're starting to see, a lot of that discussion. I mean, not just the employee mandates. You're starting to see discussion about whether students should be mandated to vaccine, or if not, whether the vaccination status should be a ticket to either coming to school for face-to-face learning, or to participate in things like interscholastic sports. So that's a lot. That's some of the discussion that's out there that we hear from parents and other stakeholders. We haven't tackled those questions yet, because that's obviously there's a lot of there's going to be a lot of debate about that. But we definitely at this point are working to help employees comply with the vaccination mandate, and then working to track the vaccination status of our kids. There is the other component that we're talking about very actively, and hopefully within the next week and a half we can have more details about, is that we've been working with public health on a screening testing approach. So as part of what you see in the recommended prevention strategies that are out there, I mean, of course we've been talking about a lot of them, like masking and distancing and vaccination. But for those who are unvaccinated, there's been a lot more discussion about screening testing and how that should work. And so, we've always been, we've envisioned that the school system would open and we would have a regular testing regimen. And so I think there is, the public health has received, I believe it's a $5 million grant that just needs to be implemented now to purchase the tests, make them available, ensure that people are trained, and then be able to administer the screening and testing, within our schools. When I look at the CDC guidance, I was anticipating that this would be like a random testing of everybody. It looks like the recommendations from CDC is that the screening and testing approach only really refers to those who have not been vaccinated. So I said, look, it looks like we're not talking about taking vaccinated and unvaccinated and just randomly testing. It looks like what the CDC is recommending is that if we are, especially if we're in a higher risk situation, that screening and testing is going to be a critical part of your strategy, whether it's weekly or more than once a week. The focus seems to be on those who are not yet vaccinated, and so we have to have that discussion, and whether that's going to be the recommended approach from public health when they start to implement their grant. I think for us, I think we're looking at training our not just our nurses. Our nurses are trained, and of course we'll refresh their training. But the testing doesn't have to be done by a medical professional. The testing can be done by others who are just trained to be able to administer the test. And we're looking at trying to make sure that we can find the least invasive tests, as possible, so that we can make it less of a traumatic experience for those who are going to submit to weekly testing. So we're looking at that versus the possibility of outsourcing that function to an outside organization. So we're prepared either way. I believe we're going to be discussing this with public health later this week, and hopefully next week we can have some recommendations that we can move forward with, so that when we return to opening, when we get past the employer mandate deadline on the 24th, that we can have a screening and testing approach ready to go shortly thereafter.
Mm-hmm. So John, what happens? I know, it sounds like it is a hard no for students and parents who don't want to go back to face-to-face. I mean, what's going to happen to these children? Are they just going to be marked absent, or they're going to be truant? Because some parents, they might just not feel safe, no matter what kind of safety protocols that GDOE puts in place.
Well, I think that is just an ongoing, hard discussion that we have to have with our parents. Now, with regard to truancy, that's where we say, look, the executive order was put out there. There has been a determination that habitual truancy, will not be enforced during this period of time, recognizing that this is a period of time where parents are, maybe withholding their kids from coming to in-person instruction. When we go back, we definitely are cognizant of the safety issues that need to be addressed. I have to say, I mean, it's a hard conversation. I mean, to convince parents that despite the number of cases that we report, none of those cases are a product of spread within the schools. All of those cases came from home. All of the cases came from the community. No matter how long the school system is shut down, the number of kids keeps rising, right? I mean, the number of kids reporting, it keeps going up. So I've had kids who've been out of school for 2.5 weeks. They call because they're responsible. They say, well, we just want to let the school know my kid tested positive. And we said, well, because that's not on campus, and you haven't even, that 10 days that we would look backwards and, try to assess your infectious, when your infectious stage was, you're not on campus, so we're not reporting it, but they reported to GDOE, and we've been reporting those numbers only when it comes to kids who have been on campus, right? But the kids are not, they haven't stopped being infected, just because schools have been closed. The numbers have risen, the numbers continue to rise, and I think that's something we have to grapple with as a community. It's not, the schools haven't been the cause of the issue or the problem. Now, of course, the fear, is that when they go to school, it's gonna happen. Well, at this point, we're shut down. It's not happening at school. We need to get control of what's happening in the community and make sure we take care of that. Take care of the source of the problem, which is out in the events where they found these things to be taking place. And the schools will need to do their part. I am, again, relieved that we've had some time, to be shut down, and as well as to have walked through our schools of public health, because in our walkthroughs of public health, we can see where the areas of risk are versus where the schools are doing well. So we recognize, of course, the cafeteria is kind of an open concern because that's where the masks get taken off. So this week, we were glad for that extra time, because we've been able to receive and start to install the cafeteria plexiglass, dividing where kids are sitting and eating. So that's something that is already underway, and when our kids and employees and families return to the schools, they'll see that additional support in place. I mean, the requirement from CDC is physical distancing. So installing the plexiglass was just an additional measure based on our observations of public health. That even though there's distancing, these are little kids and people are going to be worried and concerned, and their masks are off. So I said, if we're able to kind of, go beyond what we need to address that situation, then let's go ahead and do so. Whereas in the classroom, that hasn't been as much of a concern because kids have their mask on, there's distancing, and we've observed how the classes are, and they're pretty orderly. So that's one area. And then the other area is the physical distancing outside of the classroom. So, during lunch, during the break, when kids are hanging out, especially at the secondary schools. So, we've had a shipment that's finally, we're going to come in shortly, and hopefully in time for us to implement of heavy duty canopies and tables and chairs that we can put on the outside of, outside the classroom and in the common areas to assist schools with physical distancing during their breaks and during their time outside the classroom. So those two areas, are concerns. I mean, there's not evidence that we've seen any spread within the schools, but we've seen areas that, look, we might want to tighten up and provide support to address those issues. And so this time has bought us a little bit of extra time to get those shipments in and begin the installation. So we're not saying that we can't improve. We will always work to improve. And this has benefited us in that way. So when people return to school, they will see some of these additional supports in place. And, then we can hopefully assure our parents that we are safe. When we start in cohorts, I mean, I think that's another thing that's come out of our parent and stakeholder discussions, that I think cohort seems to be the idea that's been floated that seems to have more support, and at least in terms of understanding how it's going to help with safety. It's going to be an interim solution. We're not doing cohorts all year. That's not the intent. But while we are, in the high risk, measure of risk, in the community, that's probably going to be our approach until those numbers come down. And once those numbers come down, we can then resume, full in-person instruction.
Right.
So again, it's not an easy conversation. There's a lot of science that if you were following the science, you still have to read the science to make sure you understand what's going on. And I've done that. I've tried to keep up with it. And like I said, that information gets updated frequently.
Yeah.
So even if you say, hey, follow the science, that still takes a lot of work.
Yeah.
If you're not just going to simply rely on your healthcare professionals. But it's a lot easier to take a look at what's going around on social media. Unfortunately, a lot of that is mixed in with a lot of misinformation. And so sorting that out is a tough, a tough thing to do for our families.
Well, let's look at the information that we do have, though, John. And I want to kind of go back to what you had said, and then the intent of the executive order that suspended temporarily the face-to-face learning. I want to say when the governor announced that, she had said it was only a matter of time before the cases hit the schools, and that she would look at the positive cases and all these different factors to make a decision about returning to face-to-face. But, like you said, we have to control what's going on in the community, and that's not happening, right? We haven't seen a change. In fact, it's gotten worse, right, with these dead on arrivals and the high positivity that we're seeing every day. So when you say that we got to get a hold of things in the community and it hasn't changed, I'm sure you can understand the parents' mentality, right? Is that, well,
right? Well, I stressed that to the governor and her team when we discussed this about a week ago, when we had been shut down for 2 weeks, and she was indicating that she wanted to consider reauthorizing us to open up again. And my first response was, Governor, is public health ready to go out there and explain what this means to our community? Because we're in a worse situation than we were 2 weeks ago when you decided to close. Now, I think what's driving, and again, I'm not privy to the day-to-day numbers and information, but there are healthcare experts and professionals advising her that are, I believe, which is, in our conversation, she did indicate that what we're seeing, even though the cases are rising and so forth, that the impact on children is not severe as compared to those who are in older age groups and higher risk age groups. And what we're seeing is that the children are being infected. Their symptoms, they're mostly either asymptomatic or mild. And that, I guess my read on that is that when you look at the data, when you look at what's happening, is that it's the issue is really the adults who are being infected. So your children may be infected and may transmit it to an adult, a high-risk adult, an unvaccinated adult, but the children themselves don't appear at this point to be in a high-risk situation where they require hospitalization or require, anything more than a couple of days to recover. So that was my read on, that conversation a while ago. Now, of course, I'm not privy to the day-to-day, and that information can change. And that information is completely relevant to our decisions to open and reopen. And that's something that we've continued to request and say, to indicate that that's something that we're going to need to understand, not just the overall numbers, but the pediatric numbers. How does this virus impact kids? Because, we're talking about hospitalizations and deaths and so forth. But what our parents are doing is they're just transferring that and saying, well, our kids are in that same risk category and we don't want our kids to die. We don't want our kids to go in a hospital. Now, if there is something that they are relying on to show and demonstrate that kids can be safe and can be, won't be severely affected, then that really needs to be discussed and communicated. And I think that's why we had those two stakeholder sessions, because I told her that I'm not in a position to be able to say those things. I don't have the expertise or the credibility with regard to the healthcare information. Someone from your side needs to speak up about that and explain it so that, and build confidence in the community that what we're doing as we track the information related to children, that the kids are going to be safe from a healthcare standpoint, and that the risks of returning are not as high as, we're perceiving. So, that's a struggle for us too, because, again, we're tracking, we want to know, tell me the first time you see a serious case. Tell me when you talk about the death or hospitalization, we need to know, are those kids?
Mm-hmm.
Because otherwise we're just assuming these are older people, they've got underlying conditions or something, but
we're seeing
the
it
narrative about children needs to be really clear.
Yeah. I mean, I know you're seeing it in the States, John. They had the record numbers of the pediatric hospitalizations. But we also...
I am seeing that. The problem is, in looking at that data, is there was a very close correlation to the states in which those hospitalizations are being seen. So the record numbers you're seeing happen to be in areas where they can't figure out whether wearing a mask is a good thing, right? So that's the problem. It's like, well, now I understand why your hospitalization rates are going up, because you're banning the use of masks in the schools.
Right.
Yeah. So there is information there, but we need someone to help. I guess what I'm saying, we need someone to help make sense of it.
Yeah.
For us.
Well,
so
I think the number,
and
I get what you're saying, but the number I saw in the story we ran was something like 700,000 nationwide, or something crazy. But we saw another national story about the reopening of schools in New York, and one thing that they had mentioned, kind of as an aside in the reporting, was that each classroom has 2 of these HEPA air purifiers or whatever. So where are we with those for GDOE schools?
So that is and so we had to cancel and reissue that procurement because we had protests that were filed against that. I mean, it's we're looking at one in every classroom, and these are actually what I would say. I guess these are not, you're saying 2 HEPA filters. We're talking about commercial style filters. So it's high volume, it's very competitive, and there were some concerns raised about it, and we did not want it to get stuck in the procurement protest stage. So we last week, I believe, we canceled it and are reissuing it to try to get that along. So again, that's gonna the extra time does help us in that regard. The HEPA filters are not necessarily a requirement to operate, but they are something that we know, especially for our elementary school students, where vaccination is not an option. That's really the concern for me, is because I can tell our secondary school parents that vaccination's available for our students, that the employees are required to be vaccinated, and I have 2 kids in secondary school, and I would not be doing anything that I would not feel safe having my own kids go to school. But of course, the elementary school students, I think the earliest I've heard, again, this would just be a rumor, but the earliest I've heard is maybe end of October for a possible vaccine for the under 12. So until then, I know that parents are going to be really concerned about, we don't even have that extra option to protect our kids. So yeah, well, we're working on getting that procured and get that prioritized for this next round, but that's not here yet.
You got to get on that emergency procurement they're doing everywhere else. It's like boom, 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 boom.
Well, I think part of the challenge was I think part of the challenge in our procurement is that we indicated that we needed it within 30 days. And, I think everyone says, look, this is going to take longer to bring the volume and to, fabricate. So that's something we have to just make sure we address. But, again, with the elementary and with the secondary, if we go back, a part of it, I think part of the issue in the elementary schools, of course, it is the physical distancing outside the classroom. And so, if we're able to cohort and reduce the number of kids on campus, at least for the short term, we're hoping that at least that approach will allow our parents to feel a little bit safer. And we'll go and we'll deal with these issues as we continue to tackle them.
Yeah, because my boy Chase has a crush, and he wants to be a little bit closer than 6 feet.
Well, hopefully for you, if they're in the wrong cohorts, they might not see each other at all.
Let me give you a call. I want to arrange
Make it happen. Make it happen, John.
Let's do it. Thanks, John.
When I told my kids we're going to cohorts, they said, well, what are you doing? I said, we may have to go alphabetically because we want to keep families together, right?
Right.
And so I think what they did is they went and calculated their friends, what their last names were, and they're trying to, what's that cutoff letter?
Yeah. Right.
Thanks, John.
Thanks, John.
All right. Thanks, everybody. Thanks.
There you go. John Fernandez, GDOE Superintendent. Comments going off. Thank you guys. The Facebook Live.
You know, those virtual input sessions, man, way to go, GDOE, in offering that up. Because I sat in on a couple, sat in on Saturday, I think, when the governor appeared, and parents were on it. They had students that were in there giving their suggestions and also their concerns. So it's nice that he has an open door policy like that and allowing people to just kind of sound off.
That sounds like something
bad.
that Adelup would should implement, because it kind of seems like they need to talk to the community. It's 9:13. We're going to